So we went to the Blackboard. This is a Blackboard in Londiani. It's actually, first of all, we ended up in Londiani through some mutual friendships. Londiani is in Kenya. And a group of us from Mayo happened to be there for not a partnership reason. And on the Blackboards, the community, mainly mothers at that point, were working out their needs assessment. So we ended up just visiting this area, and they were working on their needs assessment on the Blackboard. And the partnership that we now have, that I'm presenting to you today, evolved out of seeing community mothers working on a Blackboard in Londiani, or one of the villages near Londiani. So in this wordy slide, the top 3 words there for our partnership, where we are trying to be innovative, is nesting, embedding, and matching. So we have nested in a wider community development project. So our partnership came from a wide community development programme with Friends of Londiani, and Carol is here from the office today, which is a Cork-based charity, but we won't blame them for that. For those of you who don't know where Cork is, it's the other capital in Ireland. It's south of here. So the charity partner, NGO partner, is Friends of Londiani. They already had a community development programme, and our partnership came out of that, so quite different to how some of the others have evolved here today. And the charity was evolving as a stakeholder within the community, so while trying to stay non-governmental, ended up having to actually obviously partner with lots of government organisations in that area. Our programme then, our partnership, was embedded at the time that the Kenyan Community Health Strategy was getting going, and our focus initially was maternal and newborn survival, because that's what the mothers had written on the Blackboard. They didn't want any more orphans. By definition in Kenya, the mother has died rather than the father as well, and they thought that maternity units was the answer to not having more orphans. So they were doing their own needs assessment, and we ended up then wondering, how can we partner? Because they'd asked us, you're coming from a hospital in Ireland, can you assist in some way? And at that time we were learning our own geography, adapting to life in Kenya, and learning about tropical medicine. So we had our own needs for being there in the first place. And the only reference material we could find at that time in Ireland was the Irish Aid Schools Linking Programme, which went on to inform the worldwide schools programme. And the essentials of what's in ESTHER, good quality partnerships, were delineated for schools partnerships. So we took it from the education sector, we applied it to the health sector, and we started working with a study tour from our staff and the Londiani staff, and then ultimately looking at whether we would advance our partnership a little bit further. And when we came to doing needs, and in coming here today, I thought preparing 3 slides is very simple. But as I reflected on when we did our partnership needs assessment, we didn't really do it at the beginning. I'm not sure I should say that, admit to that in this situation, but I guess we're evolving and we're learning good practice as we go, and we're doing a continual needs assessment for both partners as we go. But fortunately, we found a match in our needs. So our southern partners were looking for business help with annual operating planning, with professional development for all cadres of staff, clinical allied help in management, and they were looking for how capital development could move forward at a time when the global north was moving into recessionary years. The northern partner, Mayo University Hospital on the western seaboard here, had issues with annual service planning as it joined a wider group, and having to negotiate its position within a wider group where funding is difficult to spread and share equally amongst all users, because we don't know what equal is. And I don't mean that in a facetious way, I mean that in a real way. We don't know how to measure equity very well. We think we know how to measure inequity, but we don't always know how to measure equity. So with our northern partners, we wanted service planning help. We needed professional development. We were looking after more mothers that had been born in sub-Saharan Africa, and we wanted to be responsive to their needs. We had more migrant groups coming into the west of Ireland at this time, so we had an interest in the global health that migration brings to any part of the world. And we are striving for a big international airport in Mayo as well. And we've managed a couple of transatlantic flights, but otherwise it's Ryanair in and out of London is about all we can do. So we needed assistance, and we needed development control help as well. And we found that if we worked together with our Kenyan partners, that we were able to recalibrate for ourselves back in Mayo, and without creating too much burden on either organisation when we switched from being host to being traveller, we both realised that we gained from discussing our issues in the context of partnering for collaborative practice and moving forward. So I think the morning's talks have covered the types of activities that we cover, and I think all partnerships, whether they start off to develop clinical learning together or health financing together, ultimately will have to diverge into the greater general management of whatever health system we're in. And that's certainly where we found ourselves, even though initially we thought we would stay in clinical learning together. Nadine specifically asked me to mention our caesarean audits in both settings, and hence the title Too Much Too Soon or Too Little Too Late. And the article that writes this beautifully was just published this year, but it's an area that we've been working in the Lancet series on maternal health that just came out a month or 6 weeks ago. Birth interventions worldwide are a problem, where there's huge disparities, as you know, in low and middle income and high income settings. And we find in Mayo that a third of our mothers end up delivering by caesarean birth. And we found initially in Londiani that less than 1% had access to caesarean birth when it was required. And we don't know what the right number is. We don't know if it's 10, 20, 30%, but we do know from the outcomes for mothers and babies. And the challenge for today is just around the corner. There's a large maternal morbidity meeting from the School of Midwifery in Trinity on that had to be sacrificed for this meeting, where they're looking at morbidity in our population here that we really don't measure very well. So we know if a mum dies or if a baby dies that we might have done too little too late, but in our setting we might have done too much too soon. So it's finding that reciprocity in our relationship that we can realistically do audit together, clinical audit together, that's equally meaningful for both groups that are doing this work together. And so by engaging in capital development in Londiani and getting the operating theatre functioning and bringing the access to caesarean birth and ultimately the commissioning then as staff training, Londiani has been able to show reduction in maternal mortality and perinatal mortality, but not as beautifully as Tony has with the neonatal resus programme. And in Mayo, trying to move our staff who visited are more empowered to say to the woman, maybe you don't need the epidural just now, which is completely going to switch you over from a low intensity setting into a high intensity setting where all the other interventions follow forward. So this is our challenge, is finding the balance, and that's where our partnership is really helping. With reciprocity and learning, I believe very strongly that while so many people, when they're thinking about getting involved for the first time, say, well, I don't really want to become involved unless I can help, we need to start somewhere else. It's not a good starting place. I believe that we need to know how we can help. We're just all there to learn, and then whatever comes out of that, well and good. So thank you for listening.